Superbugs greatly complicate medical treatment for patients. Treatment is often lengthy and complex. In 2015, Ashish contracted a superbug infection in his lungs. He had multi-drug resistant tuberculosis and it took him 4 years of treatment and 3 months of isolation with high doses of antibiotics to recover from the disease.
मेरा नाम आशीष है। मैं एक मिडिल क्लास फैमिली से बिलोंग करता हूँ। आज से 4 साल पहले धीरे धीरे मेरे को बुखार आना चालू हुआ और बुखार इस गनीमत पे पहुँच गया कि उसने मुझे मौत के मुंह तक पहुँचा दिया। फिर मैं यहाँ पर आर.के. मिशन हॉस्पिटल आया। वहाँ पे मैंने आके डॉक्टर रमा मैम से मिला। उन्होंने मेरी सारी जांचें कराई। जांच के दौरान मुझे पता चला कि मुझे MDR बीमारी की शिकायत हो चुकी है। मेरे परिवार वाले बहुत दुखी हो चुके थे। पहले ही वो मेरी सिस्टर के पीछे बहुत पैसा लगा चुके थे। जो उनकी जमा पूंजी थी, जो उन्होंने कमाया, जो उन्होंने जोड़ा, उन्होंने सब उसके पीछे अपनी लगा दिया था। अब वो यही सोच रहे थे कि हम अपने बेटे को बचाने के लिए कहाँ से लाएं। तो क्योंकि मैं भी अब इतना समझदार हूँ, मैं भी अपने परिवार की प्रॉब्लम समझता था। फिर मैं दोबारा हॉस्पिटल सीधा चला गया। वहाँ गया, वहाँ मैं निशा मैम से मिला। निशा मैम ने मुझे बताया कि आपको 3 महीने यहाँ हॉस्पिटल में एडमिट रहना पड़ेगा। जो हम बीडाकुलिन टैबलेट चलाएंगे उसकी हफ्ते में कल्चर जाएंगे। पता लगता रहेगा कि कितने % शरीर में से बीमारी कम हो रही है। फिर डॉक्टर ने मुझे बोला कि आप रह पाओगे? मैं कहा हाँ जी, मैं रह लूँगा। फिर मैं 3 महीने तक वहीं पे एडमिट रहा। 3 महीने कैसे काटे हैं मैं जानता हूँ। एक दिन मैं कैसे काटता था। ना कोई रिश्तेदार आता था, ना पापा आते थे, ना कोई दोस्त आता था। सिर्फ मैं अकेला वहाँ पड़ा रहता था बस। किसी से बोलना नहीं, किसी से चालना नहीं, किसी से कुछ नहीं। अंदर ही अंदर मेरा मन करता था कि आज भी कोई मेरे पास आके मेरे से बात कर ले, कोई मेरा हालचाल पूछ ले, कोई कुछ कर ले। कोई नहीं आता था। सिर्फ एक माँ एक ऐसी जो हमेशा मेरे साथ खड़ी रही। अब जैसे नॉर्मल लाइफ चलती है वैसी मैं लाइफ अपनी जी रहा हूँ। लेकिन अब ये है कि मैं किसी अपने रिलेटिव परिवार वाले, मतलब जो मौसी वगैरह है, मामा वगैरह, मैं किसी से ज़्यादा मतलब नहीं रखता। क्योंकि वही लोगों ने इतनी मेरी बदनामी कर दी, जगह जगह लोगों को कह दिया कि इसको ऐसी ऐसी बीमारियाँ हो गई। अब मैं पूरी तरह से स्वस्थ हूँ। अब मैं बैंक में फाइनेंशियल की जॉब करता हूँ। डेली अपनी ड्यूटी और ड्यूटी से घर, और अपनी आगे स्टडी कर रहा हूँ अपनी लाइफ बनाने के लिए।
After 3 months, Ashish was healthy enough to fight the infection on his own. The superbug remains in his system and could be fatal if he becomes ill again.
This patient came to us, he was in bad shape. He was not even able to stand or talk properly. And there always he used to come alone. I always used to tell him to bring someone with you that we can motivate them also. But he used to come all alone over here. And as the treatment proceeded, he improved. And now you can see him that he is a nice young boy working for his livelihood, working in some bank, and he is full of life now.
Ashish's case is only one of many. By 2050, more than 10 million people could die from antibiotic-resistant infections every year. In India, various social factors such as self-medication by patients, access to antibiotics without prescription from pharmacies, use of old prescriptions to buy antibiotics and lack of knowledge about when to use antibiotics have traditionally driven inappropriate antibiotic use among the common people. This situation is now changing thanks to regulations and awareness campaigns by several agencies. Pharmacy shop owner like Amit Chaudhary in Kolkata are now following government and association guidelines to regulate over-the-counter antibiotic sales.
पहले एंटीबायोटिक्स विदाउट प्रेस्क्रिप्शन बिक्री होता था ओवर द काउंटर। अभी ये नहीं होता है क्योंकि अभी हम लोग के एसोसिएशन, फार्मास एसोसिएशन मना करते हैं इस तरह एंटीबायोटिक का मिसयूज़ करने के लिए। तो हमारे दुकान से एटलीस्ट हम ओवर द काउंटर विदाउट वैलिड प्रेस्क्रिप्शन एंटीबायोटिक्स नहीं बिक्री करते हैं। कोई इंसिस्ट करता है आके 2 दिन के लिए दे दीजिए, 3 दिन के लिए दे दीजिए, हम उनको मना करते हैं क्योंकि अभी एंटीबायोटिक्स का मिसयूज़ बहुत ज़्यादा बढ़ गया है और इसीलिए एंटीबायोटिक्स नया कुछ निकल भी नहीं रहा है। तो हम लोग, मेरे काउंटर से मैं एंटीबायोटिक्स विदाउट वैलिड प्रेस्क्रिप्शन नहीं देता हूँ। हमारे पास कुछ पेशेंट ये भी आते हैं कि पुराना 6 महीना 7 महीना पुराने पेशेंट पुराने प्रिस्क्रिप्शन लेके आते हैं, वैलिड प्रिस्क्रिप्शन था तब उन्होंने उस टाइम उनका जो प्रॉब्लम था डॉक्टर को दिखा के उन्होंने लिया था, मगर सेम प्रॉब्लम उनको मालूम हो रहा है कि सेम प्रॉब्लम उनको अभी हुआ है, तो हम उनको ये पुराना प्रिस्क्रिप्शन देके दवाई नहीं देते हैं, क्योंकि 6-7 महीने पहले जो प्रिस्क्रिप्शन है वो वैलिड नहीं होता है। और अभी जो उनको तबीयत ख़राब है वो किस लिए हो रहा है, शायद ये एंटीबायोटिक उस बीमारी के लिए नहीं भी हो सकता है, तो हम ये वैलिड प्रिस्क्रिप्शन नहीं मानते हैं, तो हम दवाई एंटीबायोटिक्स नहीं देते हैं। अभी गवर्नमेंट ऑफ इंडिया शेड्यूल एज ड्रग जो लाल मार्किंग किया हुआ है, इस मार्किंग का मतलब है ये शेड्यूल एज ड्रग है जो विदाउट प्रिस्क्रिप्शन, वैलिड प्रिस्क्रिप्शन हम अपने काउंटर से, ओवर द काउंटर से सेल नहीं कर सकते हैं।
General practitioners like Dr. Tapas Ray also advise patients not to use antibiotics without prescriptions.
As a general physician, I always find some patients are requesting me to prescribe antibiotics for their speedy recovery. I sometimes find some patients don't complete their full course. They stop their medicine midway. They should follow the physician's directive. Physicians are the best person who will judge you and prescribe you. Some patients are using their old prescriptions, which was prescribed by the doctors 6 months, 1 year, 2 years before. It is very dangerous for them. Don't use antibiotics without any medical supervision.
In the last 70 years, antibiotics have saved hundreds of millions of lives. By giving us the power to kill harmful bacteria, these essential medicines allow us to treat diseases that were once untreatable. As we overuse and misuse antibiotics, we give the bacteria opportunity to develop resistance, defeating the benefit of these life-saving medicines. The National Action Plan has addressed the need to restrict the use of antibiotics to be only when necessary. Dr. Devi Prasad Shetty, a renowned surgeon, talks about the responsible use of antibiotics by medical professionals.
Lot of the diseases human beings suffer from are caused by bacterial infection. These are tiny bugs which enters your body and causes various illnesses like a pneumonia or a TB or typhoid. All these diseases, when you suffer from, you become very unwell. Today we are facing a major crisis. We are almost going back to the pre-penicillin era of antibiotic resistance. It is as if we do not have any antibiotic to give to the patients. All this has happened because bacteria have become much smarter than us. They learned that we are coming up with all types of antibiotics to kill them, and they learned to adapt themselves. Earlier, the antibiotic which were supposed to kill them. Today, these bacteria have all these antibiotics for breakfast. Most of the antibiotic which were lethal to the bacteria, today they are ineffective. So this is a major crisis of antibiotic resistance, which is the greatest threat to the human existence. I have a simple message to all of you. We do fall sick. We do get cold and cough, we get fever, body ache. Do not pressurize your doctor to prescribe antibiotic unless the doctor feels you need antibiotic. If you pressurize them, doctors will be helpless. They will be forced to prescribe antibiotic, but you are hurting yourself. By taking antibiotic when it is not required, you are gradually training your bacteria in your own body. I want to let you know, all of us have millions and billions of bacteria in our body. in our mouth, in our ear, in our intestine, and these are protective bacteria. Without those bacteria, we cannot survive. But by taking antibiotics, you are going to kill them. One day when you genuinely fall sick, when you need antibiotic, believe me, there will not be any antibiotic left to treat you.
Globally, healthcare-associated infections are a major burden for patients, society and the healthcare management. Nurses, who form 2/3 of health workforce in India, have a critical role in reducing such infections, especially hospital-acquired infections. Ms. Jacinta Gunjial is working as a specialized infection control nurse for the past 24 years at the Jai Prakash Narayan Apex Trauma Center of the All India Institute of Medical Science in New Delhi.
Infection control is a big challenge these days. Antimicrobial resistance is also a big challenge for all of us in the healthcare delivery system. As an infection control nurse, we've been trying to inculcate a kind of behavioral change in every healthcare worker. Infection control nurse play a very vital role in the prevention of infections in the patient. As an infection control nurse, I propagate the practice of hand hygiene among all healthcare workers. As we all know that hand hygiene is the single most cost-effective in the prevention of infection control and prevention in patients. So we strictly educate, monitor, motivate and sensitize all cadres of healthcare worker in providing the information required and to enhance the compliance to hand hygiene practices in our center. As an infection control nurse, the other healthcare worker, how to comply with the BMW rules in healthcare delivery system. Every bin is for a particular waste and these are called biomedical waste. The nurse has to liaison with the clinicians, the microbiologists, or all the subordinates and work towards infection prevention practices in the clinical.
Dr. Sanjay Bhattacharya is a consultant microbiologist at Tata Medical Center, Kolkata, works closely with the Infection Control Department and talks about the role of nurses and other dimensions of hospital-acquired infections.
Hospital infection prevention and control is a big thing in modern medicine because as the complexity of the healthcare increases and we move from simple aspects of healthcare to more complex and complicated aspects of healthcare, be it chemotherapy, be it major surgery, be it transplantation, be it heart surgery, be it joint surgery. So as these complexities increase, the chances of healthcare associated infections also increase. The role of the infection control nurses and the nursing department is very, very important with regard to prevention of healthcare associated infection. Healthcare associated infections, which were also called hospital acquired infections, these are a phenomenon not just in India, but they are a phenomenon globally. Be it the developing country or developed country, be it countries who are industrialized or countries which are low and middle income, AIDS is found everywhere. Now, how much of healthcare associated infections we detect depend upon the systems that we have in place to detect them. It's also important that as the infection prevention and control measures improve, we will see less and less of infections. They are also present in both community hospitals, hospitals in the rural areas as well as hospitals in the cities. Now the percentage of these infections vary from one hospital to another hospital. The incidence of these infections in low and middle income countries is a few times higher than those in the developed world. And the reason is that as we improve our systems, the percentage of infections also come down significantly.
Hospital Infection Control Guideline of Indian Council of Medical Research is helping the hospitals to follow standard practices to reduce infection and saving lives of millions. In animal husbandry, livestock and poultry are often fed with antibiotics to keep animal healthy or for growth promotion. This allows the bacteria on farms to quickly develop resistance to these antibiotics. Increasing demand for meat products has promoted higher use of antibiotics in India. Drug-resistant bacteria can be transferred from animals to humans, either directly by foods such as meat, fish, egg, dairy products, or indirectly through the environment. Ramesh Chand Khatri, a poultry farmer and an office bearer of Poultry Federation of India, talks about the present scenario.
जब से मैं 1980 से पोल्ट्री इंडस्ट्री में आया हूँ, पोल्ट्री फार्म बनाया है, उस समय ना इतने डॉक्टर थे और ना इतनी अवेयरनेस थी एंटीबायोटिक यूज़ करना चाहिए या नहीं करना चाहिए। लेकिन 1982 में बीवी राव के मार्गदर्शन पर पोल्ट्री में अवेयरनेस आई और अवेयरनेस आने के बाद हर किसी को पूरी पोल्ट्री इंडस्ट्री में ये ज्ञान हो गया एक एंटीबायोटिक कम से कम यूज़ करना चाहिए। एंटीबायोटिक की डोज 3 से 5 दिन की होती है डॉक्टर की रिकमेंडेशन के हिसाब से। हमारे पोल्ट्री फार्म पर जिन चीज़ों का महत्वपूर्ण ध्यान देने की ज़रूरत है वो है सबसे पहले पानी, वातावरण और फीड। इनसे बीमारियां ज़्यादा आने का, उत्पन्न होने का की संभावना होती है। अगर इनका हम ध्यान रखते हैं तो बीमारियां कम से कम फार्म पर आएंगी और हम अपनी बीमारियों से अपने बर्ड को बचा सकते हैं। हम पानी से बीमारी रोकने के लिए एसिडिफायर और सैनिटाइज़र यूज़ करते हैं। उनसे जो बीमारियां पानी से उत्पन्न होती हैं वो फिर बर्ड के अंदर नहीं आती, जैसे कि कोलाई। वातावरण से कोई बीमारी ना आए, बायोसिक्योरिटी का हम पूर्ण रूप से ध्यान रखते हैं। डिसइंफेक्ट द्वारा हम स्प्रे करते हैं। हम अपने चिकन की गट हेल्थ के लिए फीड में प्रोबायोटिक, प्रीबायोटिक, एसेसिन ऑयल यूज़ करते हैं ताकि बर्ड की गट हेल्थ मजबूत रहे और बर्ड स्वस्थ चिकन प्रोड्यूस कर सके, हम अच्छा चिकन दे सकें। दूसरे देशों की तरह हम भी नई टेक्नोलॉजी का इस्तेमाल कर रहे हैं।
India says that antibiotic use on farms should be discouraged and instead alternatives should be found to keep animals safe while growing quickly to meet economic demand. Alternatives to antibiotics are being encouraged for use on farms, like feeding probiotics to animals and giving them natural foods that make their bodies a hostile environment to bacteria.
I'm sure with a greater focus, with newer strategies, with more awareness, mass awareness happening in this country, and also more investment going into research, would bring a sea change in managing AMR in the country.
The Ministry of Health has amended the FSSAI standards to restrict the maximum limits of antibiotics and other drugs in meat and meat products, including chicken.
If antibiotics are not used judiciously in production of animal used for food, then there is a challenge of residues coming into our food beyond the limits that we have that are safe. As far as FSSAI is concerned, we have set standards for antibiotic residue in food, in poultry, meat and meat products. We have set standards for 30 antibiotics as far as MRL is concerned, and we have banned 10 of these antibiotics for use in animal production.
According to the Global Action Plan, the first strategic objective in effectively containing AMR is to improve awareness and understanding of AMR through effective communication, education, training and campaigns. Internationally, there is evidence that awareness generation campaigns in combination with other interventions that are organized at the national level may be successful to reduce antibiotic use. After over 2 decades of work in the government sector, Ratna Devi is now engaged in maximizing health outcomes for the society. She spearheaded a campaign to reduce irrational use of antibiotics to contain AMR and piloted the Red Line campaign. This campaign was aimed at discouraging unnecessary prescription and over-the-counter sale of antibiotics, causing drug resistance for several critical diseases including TB, malaria, urinary tract infection, and even HIV.
In the year 2015 May, India was a signatory to the global campaign on antimicrobial resistance with the World Health Organization. After that, there have been many innovative approaches in India, and one of the innovative approach has been the Red Line campaign, which serves as a tool to make people aware that these are antibiotics that should not be taken without a prescription. The Red Line is simple to understand because it is just a strip that is given on the blister pack of the medicines that are prescribed by a doctor. So when the patient sees the red line, they get to know that this is a medicine that needs to be taken with caution. And whether a person is illiterate or literate or is able to read the medicines, the red line helps them to inform that if this is a medicine that is being bought from a pharmacy, then it has to be backed by a prescription.
To check the irrational use of antibiotics, the Red Line helps the users to differentiate them from other drugs.
We ran a big digital campaign through Facebook, Twitter and other social media in the year 2017. We were able to reach around 5 million people, and a lot of effort was put in to make the general public aware. So I would say we had some success in reaching out to people who are active on social media, but in a country as large and as diverse as India, we need many more such campaigns that can actually reach the people at the grassroots level. Apart from the Red Line campaign, which helps patients to identify which antibiotics need to be taken with care, antibiotics that need to be taken only with a prescription of a doctor, there have been other programs like the Swachh Bharat mission, which helps to increase hygiene amongst people so that there is reduction of infections. And reduction of infections means that there is less use of antibiotics, and therefore that automatically helps people to control their antibiotic use. There is also increased awareness about the vaccine campaign so that all children under 5 are given the vaccinations as per the national program. Again, this helps reduce use of antibiotics for vaccine preventable diseases in children under 5.
The discovery of antibiotics was the biggest boon to mankind. That was first reported by Alexander Fleming in 1928 and really revolutionized the healthcare of people. Even today it is a big boon, yes, there is no doubt about it. All our diseases, our pathogens are very largely taken care of by the antibiotics that we use. But because of the increasing number of people, our population is increasing, healthcare is more, and manufacture of antibiotics is now very high. So it is also creating a loop. It has become like a catch-22 situation where it is also a beneficial aspect for us and it is also causing great harm to us. And how is that? That is because the untreated waste that is being released into the environment from the manufacturing units, from indiscriminate use. And as an environmentalist, I have great concern about how these pathogens are now coming into the environment, which are going to cause more danger to us than help. When the antibiotics are manufactured at the industry, they are being released. If it is not really treated properly, then it's coming into the environment. But things are not really as bad as I made it sound. That is a caution that we have to take. But I want to share a success story that we at CSIR NEERI have done. So you all know that the Kumbh has just concluded very successfully, and there were very good reports of the water in the river Ganga being really clean this time. And a part of the contribution goes to us, our work at CSIR NEERI. We were very lucky that the Namami Gange project has given us this opportunity to take our research into the field. What we have done was, there were 6 drains at the Kumbh site, So these drains, they flow down and meet a nala which goes to the Sangam point. So when we went there in October, so it was totally untreated domestic wastewater that was coming. The BOD levels were high, right up to 100, expected to increase because of the oncoming population that was floating population that was going to be increased at the Kumbh site. So we went there, and NEERI treated 6 drains there using our engineering and biological tools in it. What we basically did was that we constructed our treatment right into the flowing drains. You don't need to pump out the water, take it somewhere, treat it and put it back. We made different ecological units like a sedimentation tank, an anoxic chamber, an aeration chamber, all into the nala. What we also did here was that we used a specific bacterial consortia that was designed in our lab and immobilized it and used it into the nala. We have put different biomats which have this consortia, which treat the organics flowing into the sewage. And also the remaining nutrients, like sewage is very high with nitrogen and phosphorus. So we have put floating plants. So these plants take up this excess of nutrition. And then at the end, like I said, we need to control the bacterial population, because this is where the pathogens are entering into your system, the multi-drug resistance is entering into your system. So we have also put a disinfection unit into our tanks. So now the water that flows out is safe for bathing for all the pilgrims that are coming. We have removed all the floating debris, the suspended solids, and also treated the bacteria so that the water becomes safe for all the pilgrims that were